Good afternoon. My name is Sam Bergen-Gonsalves, and firstly, I'd like to speak about the Professional Record Standards Body, Social Care Standards, to give you some background on how these were developed and how they were deployed. Then I shall hand over to Laurel Morgan-Bruce and her team at Oxley's NHS Foundation Trust, who will share with you how they've been implementing one of our standards. The PRSB develop information standards so the right information is shared whenever and wherever care is needed. They do this using highly structured and now a highly standardized approach, which makes good use of both lay experience and professional expertise. This combination of clinical expertise and lived experience being used to develop and shape guidance for deployment in real-world settings is very typical of the way in which the PRSB operates. My role has been that of citizen lead, representing the interest of the public, which is a very important role to me, especially as I'm a parent carer of a young adult with complex needs. It's really important to drive change in record standards by promoting themes that patients really care about. Key to the PRSB's role is its independence from stakeholder and funding organisations. Although it undertakes work on behalf of government bodies and medical professional organisations, it works on a commissioned basis so that standards are established in an objective way. The organisation has international links that enable it to keep abreast of international developments around information standards, particularly in relation to the rapidly shifting area of digital information. Important to its work is a partnership scheme with professional and care delivery organisations, including Royal Colleges, social care organisations, patient representative groups, and vendors. These organisations between them represent over 750,000 health and social care providers in the UK, enabling the implementation and embedding of standards in clinical practice at scale and pace. The digital social care standards were commissioned by NHS England as part of the broader NHS Digital Social Care Pathfinder programme, and the ambition was to learn from case studies within that programme, and those were the starting point for developing our standards. The areas of interest identified related to important points to the information pathway for care home residents with differing operational standards between organisations, which raised issues and where shared standards could go some way to facilitate better care. The first relates to admission from care home to hospital. This is usually an acute admission, taking place in a hurry, and is dependent upon home and community-based healthcare staff being able to access and transmit standardised clinical data to hospital staff. The quality of this information can literally be the difference between life and death. The PRSB used as their focus the concept of an e-red bag. The red bag scheme is already in place across many parts of the country. The original red bag scheme was implemented in various parts using a physical red bag that contained care records and objects of value for the patient. Although this was operationalised with varying effectiveness in different areas, it was at its best in Sutton, where highly standardised approaches to data sharing were in place. The PRSB wanted to consider how these could be incorporated in a virtual rather than a physical red bag, and this is where our focus was in developing the digital standard. The second standard relates to hospital referral to local authority. People's care needs can often change substantially during a hospital admission, and data from hospital can be critical in informing what care is required on discharge, but also how care needs are likely to change and progress beyond discharge, and how ongoing NHS input is likely to shape these. This standard was about making sure these data get to local authorities in a sensible way. The third standard relates to information that local authorities make available in shrewd views to healthcare professionals. There is much in the social care record that healthcare professionals need to inform multidisciplinary assessments, and this standard was about making sure that the relevant information is available. The fourth standard relates to About Me. This is key. It's about how we hear the patient and carer voice in our interactions with them, and is key to providing high quality person-centred care. I will elaborate more on this standard later. And finally, the care home view was developed in recognition of the fact that care homes are increasingly being given access to health and social care records in recognition of the pivotal role they play in coordinating care for the residents. Standardisation is needed given that this is an emerging field. Personally, I've been sharing About Me information for my son Shane for 8 years using digital technology, by allowing all carers and professionals access to view Shane's RixWiki. RixWikis are simple, accessible, secure, and easy to build personal websites. They can be used to create multimedia person-centered plans that use video, pictures, sounds, and words to capture the voice, the skills, aspirations, and needs of the individual. RixWikis have been developed with and for people with learning disabilities, their families, carers, and support professionals. Shane, my son, has amazing blue eyes. He's loving, affectionate. He has a cheeky sense of humour. He enjoys baking, art, swimming, and gardening. These are things you won't learn about in a report. That's the important stuff to know about Shane. Important to provide good care and support. The boring stuff, Shane is severely visually impaired. He's got cerebral palsy, severe learning disability, and he's a non-verbal communicator. Shane's About Me wiki contains information about how he communicates, what his likes and dislikes are, and how to support him in the community and in hospital and health settings. Sharing About Me information has supported us as a family through various transitions, namely moving from children's services to adult services, moving on to college, and subsequently helped us as a family to focus our attention to develop a bespoke adult service for Shane's adult life. Looking back, I can see how many other times in our life with Shane, how sharing About Me information would have helped. Imagine a child with a disability starting school, and the first information the school gets is about the child's interests, their achievements, and their likes and dislikes, instead of a list of medical diagnoses. Shane uses ankle-foot orthotics, and knowing how to put them on correctly is vital to his health and well-being. Sharing a video in and About Me records on how to do this supports the delivery of good support. If Shane's ankle-foot orthotics are not put on correctly, they rub, they cause blisters. It's painful for him. When he's recovering, he's unable to wear his orthotics. Therefore, he's unable to walk. When he's not able to walk, that affects his independence. Shane also suffers from chronic constipation. And when he's off his feet and not moving, this also affects the management of his constipation. On one occasion, Shane even ended up in hospital as a result. This is an example about how, by using and sharing About Me information, we can potentially avoid unnecessary hospital stays. For people like my son who are physically disabled, knowing and understanding not only when they need support, but also knowing what they can do for themselves and when they don't need support. This will ensure they're treated with dignity and respect. The importance of About Me information and sharing it in an emergency situation during a pandemic where patients like my son and others could potentially be admitted to hospital without a known carer or support worker to pass this information on cannot be underestimated. A couple of weeks into lockdown, my son ended up in A&E. It was a really scary time. He got a large peanut stuck in his nose. For someone with a profound learning disability, this quickly became a medical emergency. As Shane is visually impaired, I explained to the A&E nurse just to let him feel the arm cuff before taking his blood pressure. This meant he was more relaxed and prepared for what was going to happen. Responding positively to his signing, when he signed finished, and just reassuring him that it was almost finished, that enabled him to tolerate the whole procedure. Discussing with his doctor The need for Shane to be sedated using a mask and not an IV meant the right treatment plan was put in place. Imagine if I did not accompany Shane on this vital visit to A&E, which could happen in the future during the pandemic. Imagine this vital information was not shared. The medical team would have tried to sedate him using an IV because that was their initial plan. This would not have been successful for Shane, and he would become extremely distressed, displaying behaviour which is really difficult for everyone to manage. The time spent in hospital would have been increased, and an alternative treatment plan would have become necessary. This is the type of information in an About Me record where, when we share it, can make a huge difference, both to patients like Shane, but also to staff safety. We can avoid prolonged hospital admission and unnecessary patient distress just by small, reasonable adjustments, offering treatment that is both appropriate and safe. I'll now pass on to Laurel, who will share the wonderful work being carried out by Oxley's NHS Foundation Trust.
Hi, I'm Laurel Morgan-Bruce. I'm from Oxley's NHS Foundation Trust, and I am a project manager implementing a number of projects within the trust. Some background information about Oxley's. Oxley's is an NHS Foundation Trust, provides a wide range of health and social care services in South East London. We specialise in community health, mental health and learning disability services. We provide care to people of all ages and work closely with a variety of partners to ensure a well-integrated and wide-ranging amount of services. We provide those services at over 100 sites across the boroughs of Bexley, Bromley and Greenwich. And following the start of the pandemic, unlike a lot of other service providers, we went remotely using video consulting and telephone appointments. Oxley's also provide healthcare services in prisons in Kent and South East London, including Wandsworth Prison. We are a member of the South London Partnership along with South London and Maudsley NHS Foundation Trust and South West London and St George's Mental Health Trust, improving the services of mental health across the whole patch. In 2018, Oxley's became a digital exemplar fast follower and used some of the funds received for a patient-held record. It was agreed this record would be owned by the patient, so the patients would decide what information was going to be held in the record. So meetings were held with patients, carers and Oxley's staff to decide what was required. Initially separately, as we didn't want either side to influence the others. And then once those had been all gathered, we then did a prioritisation workshop with everybody in the same room. What followed was a tendering for the software development, which included service users carers being involved in that awarding of that contract. And following the awarding of the contract, the project board asked for names of what to call the system. A number were received in, and discussions about the names were undertaken at the project board meeting before Oxcare was chosen. One of the things we knew as part of Oxcare was we had to have information about the patient or service user, and it wasn't just their demographics. We wanted to have more to meet the whole range of people that were in the trust and that we service. When we made aware of the work that was being undertaken by the Professional Record Standard Body, the PRSB guidelines, in regards to the structure and the format of information that professionals of health and social care needed to know about to help an individual, it was agreed following discussions at the development work stream that it was the way we needed to go as far as implementing this information. Once the development workstream had agreed, it was approved by the project board and implemented into our system in January of this year. So we've still got a way to go and we've still got a lot of things to do in regards to it, but it is our starting point. Oxley's is one of the first NHS trusts in the country to incorporate this new standard in the format as set out by the PRSB. Up until now, we've limited the number of service users and carers involved to those on the project board or those who actually sit on the project board, or those that patients of clinicians that sit on the project board, as it's still under development. Currently, we have 100 service users and carers using the system and providing feedback. Oxcare will enable patients, service users and carers to have more control over their health and wellbeing. We will also be looking at working with our partners to look at ways to help address the issue of digital and social exclusion. I'm now going to hand over to my colleague Sharon to tell you some more about what we've been doing.
Thanks, Laurel. Hello everyone, my name is Sharon Rodriguez and I'm the Patient Information Lead for the Learning Disability Directorate. I support the Can You Understand It team. We're very fortunate in Oxley's to have an editorial team, and currently I have 6 members and they have different communication and sensory needs. The team have been running for about 10 years and have done some amazing work in Oxley's. They've been involved in producing the Bill of Rights, which is about how we communicate with people with learning disabilities. And when Laurel asked the teams, they'd be involved in the initial stages of setting up Oxcare, they were really excited and gave some really good feedback. They felt that the use of symbols and images were really important to support the various headings in Oxcare. And the use of videos for them to upload themselves or to have access to videos for some people who are unable to read. A big part of their work is to review easy read information, and they felt it was really important to have a library of easy read information so that they could then download information that they needed as and when. And they've also been really involved in producing easy read care plans and crisis plans, and to have these available by Oxcare is going to be paramount to their care. It's been great to see feedback from service users and their families and carers during the Oxcare project. And as Laurel said, there's about 100 service users and families taking part. And this part of co-production is such excellent work because it involves service users, families, carers, and staff. And the Trust really endorses service user experience. And when I heard about the About Me standard, I felt this was the right place to be in Oxcare. The standard is the best way of ensuring a person-centred approach. And within the section, the service user can include all the information that is important to them. So this would include their support network, who is important in their lives, their likes and dislikes, if they have any allergies or any specific medication. Another part of the About Me standard, which is really brilliant, is for them to record their communication and information needs. And this is part of the Accessible Information Standard that was implemented in 2015. And it enables people to be able to access health services equally, and it's part of the Equality Act. So that part of Oxcare is really important. And we can also include information about the communication passport and hospital passport. It's all vital information. And in the choice boards, if they have to communicate using choice boards, they'll have that on their system. And so hopefully it'll enable health and social care professionals to provide really effective care because they'll have that information as and when it's needed. So I'm really looking forward to the next stages in the development of Oxcare, and I'm so grateful to be part of the project. So thank you very much, and I will now hand over to Jonathan.
My name is Jonathan West, and I'm a consultant psychiatrist working at Oxley's. I work in an early intervention in psychosis team, looking after adults with a diagnosis of first episode psychosis. As a clinician, it's really important that I have accurate, up-to-date and contemporaneous information at my fingertips so that I can work out how to help and support my patients. But up until now, this information gathering has largely been me as a doctor firing questions at my patients And these are questions that I've wanted the answers to. It's not been personalised in any way. About Me is a real departure from this way of us interacting with our patients. And it will allow our patients to take ownership of the information that they wish to share with us. It provides more than a list of problems or diagnoses, which is often how we, perhaps as an NHS provider, approach these things. And it will allow our patients to communicate their strengths, their values, and their preferences about how they want to interact with us as those that are delivering their care, and hopefully delivering improved outcomes. When I was looking through the standards myself, I was interested to read about pets. And as a dog owner, how important would that be if ever I was in a crisis or needed help, that my dog would be looked after? About Me includes information that's important to the patient, and it's going to help clinicians plan for these unforeseen emergencies and crises, which will invariably happen, but hopefully it will allow us to deliver a holistic package of care. We're really pleased to have been able to include the About Me work in the Oxcare project that we've been doing in Oxley's over the last 18 months. However, Oxley's is more than just about me. And I'm really passionate as a clinician about how we're going to be able to use technology and data to really improve our patients' lives and their recovery as they proceed through our services. Oxcare is going to allow our patients access to parts of their clinical records. They'll be able to see their diary, appointments, information that we share with their GP. They'll be able to look and amend their care plan, their crisis plan. But perhaps one of the things that's most exciting for me and feels really new and exciting is the development of trackers. Within Oxcare, we've already started to build these trackers, and this will include things like smoking, sleep, mood, and alcohol. So patients will be able to go into their notes and document these things day by day, hour by hour. And this information will be fed back to the treating team, to the clinicians in real time. So that when we next meet, doctor and patient, at my fingertips, I've got this information. I've got this day-by-day account of how my patient's been feeling, how they've been sleeping, and this will then form the basis of that clinical interaction. A lot of what I've talked about so far is theoretical. I'm really passionate about the project, and I've been involved since the outset, but our patients are only just starting to use this. So I'm really happy to talk again maybe in a year's time when we've got much more evidence about what a big difference this is making. Perhaps something that's also a bit drier is some of the things that Oxcare will allow us to do behind the scenes, things that we ordinarily rely on audit for, being able to show that our patients are involved in their care planning, that they're accessing their records, that they're contributing. What better way to provide this information if we know that at midnight last night, a patient logged onto their records and were making changes to it? That provides us real evidence that we really are engaging with our patients. And this is really an interactive way to plan and deliver care. Finally, I'd also like to thank Rewired for allowing us to present today. And if anybody has any information or want to think about how they take About Me forward in their organisation, then the email at the bottom for PRSB, please refer to that. Thank you.